Good morning. My name is Amy Cohen, and I should advance the slide and show you a little bit. My husband and I are parents to one 8-year-old son. His name is Noah, and hopefully, as you can see from these pictures, he is quite a character. He's kind of a quirky and exuberant guy, and we always describe him as a fascinating combination of temperamentally easy and medically complex. We are hugely fortunate that he's received exceptional coordinated care here at the hospital, and that he really loves this hospital and thinks of it as sort of his special place, or this huge building filled with people that he knows sort of love and care about him and are invested in his outcomes. And so Noah has spent a lot of time at the hospital. He's had more than 20 surgeries, all but 5 of them here at Vermont Children's Hospital. And surgeries involving his trachea, his esophagus, his lungs, his heart, his spine, his bowel, and his bladder. And I wanted to take a couple minutes today and tell a little bit about one of the more recent surgical experiences that he had last winter. And through these stories, I'm hoping to highlight a little bit about the core components of patient and family-centered care, particularly focusing on participation and information sharing. So last winter, after despite a lot of intervention around Noah's bladder health and urological needs, including a bladder augmentation, bladder neck reconstruction, really religious adherence to clean intermittent catheterization through a Mitrofanoff, Noah was continuing to experience really significant incontinence, such that he was always wet, and at the same time he had chronic UTIs. He was in pain most of the time, and our family with our medical team made the what felt like to us a really difficult decision to do a bladder neck closure. Kind of controversial. It's not done very frequently. It's very permanent. And it wasn't an easy decision to come to, but we felt like it was the right thing to do on the right time. And so he had that surgery in the winter, and it was a difficult procedure. It was long and complicated, and the doctor came out midway through and said that because he's had so many surgical interventions, the scar tissue in his abdomen is pretty much like concrete, that it was difficult to get through. And he said that he thought he might be able to continue, but he might really damage the bladder in the process, or we could decide to stop, but if we stopped, that probably meant that you couldn't go back in, that this was sort of a final decision because it was so difficult to get to the space. And so we debated and quick moments there and decided to proceed, knowing that this was maybe the last opportunity to get him continent and dry, and knowing how important that was for sort of long-term social outcomes for him. And so that surgery, fortunately, they were able to get to the right spot. They finished, closed up. He had a hospital stay. And then we had a period of 3.5 to 4 weeks where we literally woke up every 2 hours to be sure that the catheter in place was draining, that there was no pressure on his bladder, that it had the chance to heal. And so we were, we felt like we were in the home stretch, that things were sort of going well. And we had been talking up with my son just sort of, that this was exciting, and that his movement was really restricted at the time, his activities were really restricted, that we were ready to be done with this part and sort of move on. And so the process was to have a study under fluoroscopy and then remove the catheters that were in place. And the night before, our appointment was at like 8:30 in the morning. The night before, as I was getting ready to put him to bed, and he'd been wearing the whole double pull-up to drain into, I saw a tiny speck of what I thought might have been urine in the inside pull-up, and I thought, is this possible? It's been 4 weeks. He's been completely dry. This can't be the case. And my husband said, don't jump to conclusions. Who knows? These tubes are hard to manage. They're always in the wrong spot, and who knows how that got there. But we wound up in fluoroscopy the next morning, and I did the dance that parents do when you're trying to keep your kids busy during these radiological studies. So I'm trying to engage him and keep him busy and laughing and helping to move him from side to side, and I'm at the same time sort of staring intently at the monitors to sort of see the pictures. And I can watch on the image his bladder filling up and becoming black and sort of turning into a nice red ball. And black image, and at the end I start to see the black sort of fade down, and I remember that a tear rolled down my eye, and I looked up to the folks who were there and I said, that's not what I want to see, is it? That's what we were hoping to avoid. And the technician who was standing there said, that's really something you have to take up with your doctor. And fortunately, the radiologist there turned around and said, Amy really knows what she's looking at. That's not what we want to see. I'm sorry. I know that's disappointing. And so, I just felt like we had lost this opportunity that we'd been hoping for so much. And what happened next was just great, examples of the great coordination that we experience when we're here. So the child life specialist who'd been with us called upstairs to the children's specialty clinic, and she said, Amy and Noah are on their way up. Someone should meet them because they need some extra support and attention today. And we got up and we saw our doctor, and a big group came into the room, the nurse and the doctor and the resident, and we talked. And basically we talked about the fact that this was unexpected, that he had developed a fistula, that the surgical site hadn't healed despite a really long period of time. We talked about the fact that this was disappointing and that I was, I don't know that Noah really understood, but that I was heartbroken. And we talked about the fact that when things can be complicated, Noah's going to make it complicated. And then we talked about options. And he laid out a bunch of ideas about what to do next and really talked about the idea of not giving up hope. And that was important and powerful. And then he talked about sort of what the options were. And frankly, none of them were particularly clear. It was really difficult to know what to do and what kind of decision to make. And so I asked the question that I ask all of my providers when I'm feeling stuck. And I said, if you were your kid, what do you think you would do? And the answer wasn't some of the other answers that I've sometimes heard around, that's not a fair question, or this is really your decision to make, or, the answer seems really obvious. What he said was, I don't really know. And I think a lot about that, because I know that's a hard message for healthcare providers to give your patients. But he said, I don't know, but I do know what I would do if I was you and how I would get the information to make that decision. And so what we agreed on was that he identified 4 of the pediatric specialists in this area nationally. He sent an email to them. He CC'd me on the email. He gave in very clear language an explanation of what was going on. And then he asked for some advice about what to do or what option might be best. And he said, please reply to all. And I think it's an incredible example of what it really means to include parents and let them participate and to really share information. So there wasn't a clear answer in this case. I was a partner in the decision, and we were going to get information together, but not have a professional get it and sort of filter it and share it to a family, but have me have the chance to sort of hear the same information and get the same feedback. And I think about that example a lot because I did feel incredibly respected at the time. I felt like my family had the chance to be an equal participant in the discussion and hear the information without it being filtered or without there being sort of someone's personal bias weighing in. And I felt like it was a great example of what people are often concerned about when we talk about involving parents and patients in decision making. The idea often comes up that we can't really include parents in rounding or in nursing bedside report because they don't like to deal with uncertainty. And the true response is that particularly parents of kids with chronic health issues, we live in the world of uncertainty, and we expect that there's going to be uncertainty in our medical care as well. But what we want to know from you is that you're confident, that you have a way to go about getting the information and sharing it with us, including us in the decision-making process. And for me, that was a really powerful example. And so the next morning, when he called at 8:30, and said he had an idea or a plan, I knew what that plan was going to be because I had read all those emails. And while I wasn't confident that the plan was going to work, I was confident that it was the plan that we wanted to try. And so the plan was basically to go back into surgery, which was not necessarily what any of us wanted to hear. But it was 8:30, and they called and said that this seemed like the best idea based on all of the input we'd gotten, and that time was sort of the essence. And so a few minutes later, someone else called back and said, has Noah eaten recently? And I said, he's still asleep. They said, well, great, get him up, but try and get to the hospital within a half hour because we've got a surgical splat, but it's really limited. And so, of course, I'm packing a bag. I wake him up. My husband is at work. I'm making 1,000 phone calls. I throw him in the car. And he, is just not prepared for any of this. We had been talking up the fact that we were at the end, and he was ready to go back to his routine. And so we raced to the hospital, and he cried all the way through the car. He cried throughout registration. He cried as we waited in the waiting room area to go into pre-op. And I'm managing a lot of things and trying to comfort him and tell him that this is for the best, and we're going to make a good decision. And eventually the doors of the pre-op burst open, and one of the child life specialists that he knows, comes running out and is like, Noah, you're here. I'm so excited to see you. And they spent the next 45 minutes giving CPR to his alien, who you can see there, putting IVs, reading him on a heart rate monitor, and literally he went off to surgery, the like happiest, giggliest boy. Again, literally doing chest compressions through the hall, which I worry might have frightened some of the other patients, but made Noah awfully happy and distracted. And that surgery went well. The doctor came out after and said that, he thought we'd see what happened, but he thought it was a good call and we'd made the right decision. And he said that they were wrapping up and that we could see Noah in a few minutes. And so my husband and I are really seasoned surgical patients, and we went out into the waiting room and we sat under the patient monitor to track patient progress through the operating procedure, and we waited. And we would look at the monitor and you can see if your family member is in pre-op, if they're in the operating room, or if they're in the PACU. And he, within a couple minutes, his number flashed and he was in the PACU, and we waited. And we waited. And we waited. And I, of course, was going a bit crazy. Of course, I'm thinking, we've got a history of things going wrong, and I thought, of course, something has gone wrong here. And so at about 50 minutes since the time he entered the PACU, I went up to the front desk and I said, can you please call and let them know that I'm going back to see my son? And the woman said, well, you know what, your pager will go off. If you sit back down, we'll page you when he's ready. And I said, can you please call and let them know that I'm going back to see my son? And she said, well, if you'd like to sit down, I'll call them and see when they're ready to have you come back. And I said, please call and let them know that I'm going back to see my son now. And I love telling that part of the story, in part because I do think it makes me sound like a bit of a badass. Although I imagine that the woman at the receptionist desk had another B word for me that morning. But I love to tell it because that's one of the few times that I can think of that I've actually spoken up and said, I really think I need to do this. And I can tell you how hard it is to do that. I know there are times when I'm like, I know I should be somewhere else, or I know something else should happen, but so rarely do I speak up. And I'm a confident, hopefully articulate, skilled navigator of the healthcare system, but it's incredibly hard to do because you just think about all the other things that might be going on. But I did it that day, and of course I'm proud of myself for doing it. And then I walked back, joined my son at his bedside, and my husband's trying to be sure that I'm calm and quiet and polite. And I kind of quietly watched there, and eventually the nurse who was there said, when he wakes up, he's very upset, he's crying a lot, he's unhappy. And so I've been giving him medication, and I called and got the medication increased, and we're really on top of it. And I turned and I said, he's been up. And she said, he's been up multiple times, probably 3 or 4. And I said, you have let my 7-year-old son, who is having surprise emergency surgery, wake up 3 or 4 times without his mother there? And she said, she was perfectly polite. I'm so sorry. I really wanted to get on top of the charting and the paperwork and wanted to get things really in order. And so I think time just got away from me. And so, of course, he woke up a couple minutes after, and he did wake up. He's a very articulate guy, but certainly when he's excited or distressed, he's hard to understand. And so he woke up and he was saying, I want to go home. I'm not supposed to be here. This wasn't supposed to happen today. I just want to go home. Please, someone take me home. And so, of course, this is painful for me to hear. And the nurse who was sitting at the bedside said, every time he was upset, I was rubbing his head and helping him relax and assuring them that he was safe. And you don't have to have a lot of experience with post-anesthesia to know that when kids are disoriented and upset and frightened, a stranger rubbing your head and telling you you're safe is not going to make you safe. You want your parent. And so this was this was not a great experience for us and a really powerful example for me. And what I wanted to end with was this isn't an example of a nurse making a bad decision or losing track of time, and it's not really a story about visiting procedures in the PACU, although if anyone wants to revisit visiting procedures in the PACU, I want you to contact me because I'm motivated to make that change. But it's really a story about a missed opportunity for participation. And it seems like such a small story. I wondered if it was like significant enough to share today, but there are consequences for each of those opportunities that you miss allowing people to participate fully in their care. So the consequences in this case were that I spent 50 minutes, my husband and I spent 50 minutes wondering if really something again had gone wrong, if something became complicated, if he was really struggling in some way. My son got extra pain medication that he didn't really need. In fact, he was quite comfortable, but he was emotionally distressed about the fact that he had not been anticipating and really didn't understand what would be happening when he woke up. That nurse did extra work that she really didn't need to do. I mean, I think she did put a lot of effort into trying to comfort and soothe him, but she wasn't the person best suited to do that job. And frankly, she could have been doing the other things that she was worried about, like her documentation and managing the other patients that she was responsible for if we'd been allowed to participate in his care. And finally, there was a really significant risk that this could have undermined the positive, safe association that NOAA has with this hospital that so many of you have helped me really assure stays intact despite lots of difficulties. And so it's a small moment, but every time we miss the opportunity for participation, it's a really significant moment. And so I'm hoping people will take away some of those messages and think a little bit back on our story when you think about the opportunities to really include families and share information and allow them to participate, or what happens when you don't have them at the bedside or in the discussion or sort of at the table in opportunities for care.